No matter how it is consumed, tobacco is hazardous to your health. Whether it is in the form of cigarettes, cigars, or smokeless, there is no safe method of tobacco use. Tobacco products contain many dangerous substances, which is why it should be illegal. Hi, my name is Kathleen Carpenter. At this time, I would like to preview the following topics that will be covered in this presentation, which are the health impacts of secondhand smoke, hazards for people who smoke, and the heavy burden smoking that places on our healthcare industry. If you have any questions about the material presented, please hold them until the end. For the first topic I will discuss is the consequences of secondhand smoke. There are many adverse health effects of secondhand smoke. Secondhand smoke contains around 7,000 chemicals, of which at least 70 have been known to cause cancer. In 2014, Jack Roth, professor of thoracic and cardiovascular surgery at the University of Texas, notes that secondhand smoke contains the same chemicals as active smoking. This means that non-smokers who are in the same vicinity of those that smoke are subjected to the same health consequences, which is unfair. A 2009 book published by the Institute of Medicine indicates that since 1964, more than 2.5 million people who are non-smokers have died because of secondhand smoke exposure. Think about that. Furthermore, secondhand smoke is equivalent to active smoking in the terms of the risk factors for heart disease. There's little to no difference between active smokers and non-smokers that are regularly exposed to tobacco smoke. According to the Center for Disease Control and Prevention, there is no risk-free level of exposure to secondhand smoke. The next topic I will discuss are the health hazards for people who smoke. There are many hazards associated with smoking, whether it comes in the form of cigarettes or smokeless tobacco. The statistics identify the health implications of smoking that are difficult to come by. In 2017, the Center for Disease Control and Prevention published a report that demonstrates just how damaging smoking is in our society. According to the report, the number of deaths caused by smoking exceeds the amount of deaths caused by illegal drugs, alcohol consumption, HIV, and auto accidents combined. Think about that. At this time, I'd like to turn your attention to the visual representation of someone that smokes and someone that has healthy lungs and a smoker's lung. Normally, healthy lungs tend to be light pink, which you live a longer lifespan and you have lower risk of diseases. Someone that does smoke has dark lungs, which normally are molted, which also indicates that they have damaged cells. Smokeless tobacco, also referred as chewing tobacco, has been known to cause various forms of cancer. It has been known to cause tooth loss, gum disease, oral, pancreatic, and esophageal cancer in consumers. At this time, I'd like to turn your attention to this next visual representation of someone that uses smokeless tobacco. Normally, someone that uses smokeless tobacco tend to have oral cancer and normally has periodontal disease, which in turn, periodontal disease indicates tooth loss, and you also have tooth decay. In 2004, Robert West, a professor of health psychology and the director of tobacco studies at psychology, psychiatry, and pharmaceutical sciences at the University of Pittsburgh, wrote a book that documents smoking in terms of addictive properties. This book indicates that smoking addiction can be thought of as the same terms as drug addiction because of how it affects the body. In the same way that drug addicts experience cravings, withdrawal symptoms, smokers are subjected to the same thing. Smokers also suffer from a mechanism known as nicotine hunger when they have not consumed tobacco after a certain amount of time. There are also numerous statistics that indicate how difficult it is to overcome tobacco use once it has become an addiction. Kathleen Stratton, a scholar at the Institute of Medicine in Washington, D.C., wrote a book in 2007 that identifies the staggering number of people who have unsuccessfully attempted to quit smoking. According to this book, approximately 70% of tobacco users want to quit smoking and have attempted to do so at least one time. Additionally, around 90% of smokers regret ever using tobacco products in the first place. Aside from the physical and psychological consequences of smoking, there are many monetary impacts as well. From a governmental perspective, the costs associated with providing treatment of smoking-related illnesses are enormous. Frank Sloan, a professor of health policy and management at Duke University, wrote a book entitled The Price of Smoking that highlights the financial burden smoking places on our healthcare industry. From 1962 until 2002, more than 160 studies have been conducted on the financial burdens of smoking on our healthcare industry. Of those studies, more than 2/3 of them have been conducted in the United States. As a result of these studies, it has been identified that the annual medical expenditures in the United States range from $35.3 billion to $72.8 billion, which corresponds to roughly 3.1 to 12.6 of all personal health care expenses. Think about that. Moreover, a survey conducted at the United States Department of Health and Human Services in 2002 further exacerbate the health care burdens caused by smoking. According to the survey, of the 57% of smokers that have had routine exams within the past 12 months, substantial number of persons with reported physician-diagnosed chronic condition caused by smoke despite health problems. The evidence to support the case of banning smoking in the United States is plentiful. Smoking is the number one preventable cause of premature death and has vast consequences for everyone. It is unfair for non-smokers to have to suffer from adverse health issues because of the choices of others. Smoking causes more deaths each year than illegal drug use, alcohol consumption, auto accidents, and HIV combined. In conclusion, let me summarize. Tobacco should be banned for many reasons. Tobacco use, to include both cigarettes and smokeless products, should be illegal because of how it affects people due to secondhand smoke, the health impacts of the user, which include both physical and psychological, and the heavy financial strain that it places on our healthcare industry. I hope that this has given you more information about the use of tobacco and smokeless tobacco. Does anyone have any questions? Yes.
Yes. Is there a safe way to smoke?
Is there a safe way to smoke? No. As I mentioned earlier, according to the Center for Disease Control and Prevention, there is no safe method for tobacco use. Does that answer your question?
Yes, thank you.
Do I have any other questions?
Yes.
Yes.
Why is cigarette smoke so harmful?
Well, cigarette smoke is harmful because it consists over 7,000 chemicals, of which at least 70 have been known to cause cancer. And additionally, it previously in the presentation that both